Good evening, everyone. So we started with this chapter, locomotor system, chapter 11, locomotor system, and we'll continue in that chapter only. So what we have already covered, we discussed about the nervous system, basically. So nervous system, we discussed about the brain, its different parts, function of different parts of the brain, the spine. Spinal cord will continue today. Detail of spinal cord will do, and it's really interesting. You'll thoroughly enjoy the spinal cord and its uh, function and the nerves which are coming out of spinal cord and brain. What are they doing and how are they functioning together? Okay, so we'll start with spine actually. Spine. So when we talk about spine, this is the brain and this is the spinal cord, and it has a covering on it that is actually the bony part, in which there's a cord or the nerve inside. Okay, so this is spinal cord and this is spine. Fine. Now if I show you the cross section, it's very important to understand that, because if you don't understand that, it's your understanding of spine and nerves would be incomplete. If I show you the cross section of spine, it looks something like this. See, it's a very, very important diagram. See this. You can take a screenshot of this picture, because many times you will get a cross section of spine and spinal cord, but you will not get this bony structure along with this. And this is giving you a clear picture where is this spinal cord actually is in the bony structure. Okay, so see this. This is actually the bony part, and this is also the bony part, which has the disc. So this is the disc. Okay, and this part is the spinal cord. So you are seeing the cross section, the transverse section of the spine. And in the transverse section, what you will see is this. And what is this part? Now see this part. This is whole of spinal cord, the section of spinal cord. जैसे आप प्याज को सैलेड के लिए गोल गोल ऐसे रिंग्स काट लेते हैं ना, ठीक उसी तरीके से अगर spinal cord को if you cut a section transversely, then this is what you see. Okay, and here what you need to understand is the gray part, this darker part is actually the gray matter, and the outer part is the white matter. So white matter is a area where mainly axons are present, and darker area is the area where actually the cell body is present. So in the last class we discussed about the neuron and its structure. So this is the cell body, and this long structure is the axon. So axon is mainly present in the white part. Here axons are present, and in the dark part all the cell bodies are present, and that is why it looks darker, the gray area. Okay, now another important thing you need to see is the central canal. There's a central hole in which actually the fluid CSF flows, and that is why we call it central canal. Another thing to see here is the nerves. You can see some nerves are going in and coming out. So the nerves which are going inside the spinal cord are called the efferent nerve, and the nerves which are coming out are called the efferent nerve. Efferent nerves are also called the sensory nerves, and efferent nerves are also called the motor nerves. So this is important. Motor nerve and sensory nerve, efferent nerve and efferent nerve. Just note down somewhere. With time you will learn it. The terminologies you'll remember with time. Don't worry about it. Fine. So this is about the cross section of spine. Another important thing which we need to understand are the nerves, cranial nerves and spinal nerves. So there are two types of nerves present in the spine, and these nerves are called the cranial nerves. The two types of nerves which are coming out from the central nervous system. One is called the cranial nerve, and second type is called the spinal nerve. You must have heard about these terms, cranial nerves and spinal nerves. But what are these cranial nerves and spinal nerves? So cranial nerves are the nerves which are coming out from the brain. Cranium, from the cranium. So these nerves which are coming out from the brain are actually supplying the face and this area. Only nerve which is exceptional is vagus. Vagus nerve is the longest nerve which is coming out from the brain and going down, supplying the heart, lungs, stomach, intestine, and even to the large intestine, different parts, different major organs of the body. So that is, though these nerves are actually the cranial nerves, and spinal nerves are the nerves which are coming out from the spine. So there are 12 pair of cranial nerves and 31 pair of spinal nerves. Here, that means they're coming out from both sides, left and right. I'll show you the picture of the cranial nerve. It's a very nice picture. First, see this. Just give me a moment. So here you can see some nerves are coming out from the, these are actually the spinal nerves which are coming out from the spine. So this is the spine and the nerves which are coming out. So these are the spinal nerves. Similarly, there are cranial nerves. Cranial nerves are the nerves which are coming out from the brain. I'm not getting the picture. If I get the picture, I'll show you the picture of the cranial nerves. And it's a very, I got it. See, this is also a very important chart. Very, very important chart. And save it somewhere, because what you are getting here is, one is the name of the different cranial nerves. See, all the cranial nerves are mentioned here. 1, 2, 3, 4, all the cranial nerves are marked in Roman letters. So olfactory, optic, oculomotor, these are the name of different nerves. You may not remember the name of the nerves. You may forget the name of the nerves. But if you have this chart, then which column to use most? This column is important and this column is important. Okay, so this column and this column. Both these columns are very important. So what is the name of the nerve and what is it doing? What is the name of the nerve and what is it doing? So this will help you in understanding which nerve is affected, what was its function, what function is hampered. So this is very important. Okay, so this is about cranial nerve and spinal nerve. Now we move on to a very, very important part of the nervous system, which is there in the book, and that is autonomic nervous system. Nervous system. Now, what is this autonomic nervous system? To understand autonomic nervous system, it's a big topic, very big topic. But if you remember and understand only a small part of it very clearly, then you will understand the whole basic concept of autonomic nervous system. So what is this autonomic nervous system? First, see this chart. So what to see here? You need to see that nervous system is of two types, can be divided into two parts. One is central nervous system, one is peripheral nervous system. Central nervous system means the axis, brain and spine. Okay, And the peripheral nervous system means the nervous system which consists of peripheral nerves. Periphery, the nerves which are in the periphery. And in that you have autonomic nervous system as one of the part. Just remember this. Okay, one is central, one is peripheral. In the peripheral, you have the autonomic nervous system. And under autonomic nervous system, you have two parts. One is sympathetic, one is parasympathetic. So you may have, you must have heard about the term sympathetic, parasympathetic, what are they doing? But what happens is we keep on getting confused. Which one is sympathetic, which one is parasympathetic? So if I tell you few points about sympathetic and parasympathetic, and if you note down it somewhere, always it will help you what is the sympathetic and parasympathetic. So what to do? Just note down these few points of sympathetic and parasympathetic. So what is sympathetic and what is parasympathetic? This will simplify your learning and understanding of autonomic nervous system. Sympathetic nervous system. Okay. So first point which we should understand about sympathetic nervous system is it prepares the body for fight or flight response. It's a very, very important point because this nervous system is preparing you for emergency. So whichever nervous system is getting activated during emergency condition is sympathetic. And opposite to that, parasympathetic, it inhibits body from overworking and brings it back to calm and composed state. Okay, calm and composed state. Now, point number 2, sympathetic. This point I'll explain with the diagram. Huh? Point number 2, I'll explain with diagram. Just note it down. Sympathetic ganglia are located close to spine, whereas parasympathetic ganglia are located close to organ or within organ. Point number 3, here pre-ganglionic neurons originate from T1 to T12 segment and also from L1 to L2 segment. Just note it down. Huh? I'll show you in the picture. Point number 3 in parasympathetic, here pre-ganglionic fibers or neurons originate from cranium and S2 to S4 of spine. Okay. Point number 4. Sympathetic nerves form following ganglia. cervical, thoracic, lumbar, and sacral. Whereas parasympathetic nerves, under parasympathetic nerves, I'll mention 4 cranial nerves specifically. 4 cranial nerves are oculomotor, facial, glossopharyngeal, and vagus. Basic 4 points. If you remember about autonomic nervous system, then that is more than sufficient to understand what is sympathetic and what is parasympathetic. Now, when I'll show you the picture, just go through these points one by one. Huh? See this picture. It's a very, very beautiful picture. First point was, what is the major difference between sympathetic and parasympathetic? So under first point, what did you write? It prepares, sympathetic nervous system prepares the body for all the emergency conditions, right? So now see this, eyes are under sympathetic. What is written here? Eyes are getting, pupil is getting dilated, salivary secretion is inhibited. So dry mouth under emergency condition, pupils dilate, heartbeat increases, breathing gets affected, stomach inhibits the secretion. So what happens is you don't feel hungry under emergency conditions. So all these situations, all the conditions, if you see, all these are nothing but the emergency situations. So what is activating this? The sympathetic nervous system. Whereas the opposite to that is parasympathetic. So under parasympathetic, you will see it calms down the body. So this is the first point. One is preparing the body for emergency condition, and parasympathetic is actually calming down the body. What is the second point? Sympathetic ganglia is situated close to the spine. Now see, all the nerve ganglia are situated here, close to the spine. Can you see this? Are you following what I'm saying? Yes or no? Yes or no? All the ganglia, see, all the nerves are coming out and forming a ganglia here. So ganglia are nothing but group of nerve cells situated together, which are actually helping in formation of plexus. Okay. And in case of parasympathetic, you see, these nerves are coming out and going to the organ. So either close to the organ or within the organ. See, here it is coming out and then reaching the organ, coming out from the cranium, reaching the organ. Okay, so this is a very important difference between sympathetic and parasympathetic. The third point was, most of the nerves which are coming out in sympathetic, under sympathetic, the nerves are mainly coming out from T1 to T12. Now you see, this area is T1 to T12, thoracic 1 to thoracic 12. Okay, and in case, and also in lumbar 1 and 2. So this is lumbar 1 and 2. So thoracic and lumbar area is actually the area from where the sympathetic nerves are coming out. Whereas in case of parasympathetic, the nerves are mainly coming out from the cranium and also from S2 and S4, this area. See, the nerves are coming out from here. Okay, so 4 nerves of parasympathetic, which we have already written down, are nerve number 3, nerve number 7, nerve number 9, and nerve number 10. So these are your oculomotor, facial, glossopharyngeal, and vagus. And you can see vagus nerve is the nerve which is the longest nerve supplying different important organs. So this is your sympathetic and parasympathetic. That is your autonomic nervous system. So what to remember under autonomic nervous system? You need to remember that autonomic nervous system is a part of nervous system which is peripheral nervous system, and it consists of two parts: sympathetic, parasympathetic. Sympathetic nervous system is a system which prepares the body for emergency. Parasympathetic is acting opposite to sympathetic, where it calms down and relaxes the body. Okay. Sympathetic nerves are coming out from the thoracic and lumbar region, whereas parasympathetic nerves are coming out from the brain, from the cranium and the lower part of the spine. So if you remember this much part, that is more than sufficient. Fine. So this was your autonomic nervous system. Next thing which we need to understand and remember are the plexus. It's another part of your chapter, which is plexus. So what are actually plexus? Plexus is a very important topic because you will get across this term many a times. So what is plexus? Actually, the complex network of nerve, blood vessels and lymphatic vessels. These three things together actually forms the plexus. Nerves, blood vessels, and also the lymphatic vessels. All the three are congregated, joined together in these areas. And under plexus, you will understand that there are major plexus in the body, which is number one, cervical plexus. Cervical, C-E-R-V-I-C-A-L, cervical plexus. Cervical plexus means the nerves which are coming out from the cervical area. Okay, so which nerves are these? C1, C2, C3, C4. These four nerves which are coming out from the cervical area are forming cervical plexus. Number two, brachial plexus, B-R-A-C-H-I-A-L, brachial plexus. What is brachial plexus? Brachial actually belongs to this chest, upper chest area. It's also called brachial. Okay, so C5, after C4, we are coming to C5. C5, C6, C7, C8, and T1. These nerves are forming brachial plexus. Note it down somewhere. You will come across these terms also very frequently, that brachial plexus is affected or cervical plexus is affected. So what is this cervical plexus? What is this brachial plexus? Just remember the nerve numbers. Which nerves are coming out or which nerves are forming this plexus? This will help you. Number three, thoracic plexus. T-H-O-R-A-C-I-C, thoracic plexus. Upper 11 pair of, actually this, instead of calling it plexus, if you call it nerve, it is better, because these nerves are supplying different areas. Upper 11 pair of thoracic nerves are called intercostal nerves. This is also important because many a times if you see people complain of this pain, the rib area pain, okay, and it may be related to intercostal neuralgia. Now, what is intercostal neuralgia? Nerves which are supplying the in between the nerves, in between the ribs. So what are these nerves which are supplying in between the ribs? These are nothing but the thoracic nerves, and that is why it is written intercostal nerves. Okay. Number four, lumbar plexus. Lumbar plexus means the nerves which are coming out from the lumbar area. That means T12, L1, L2, L3, L4, L5. These nerves are forming the lumbar plexus. And Number 5 is sacral plexus. Sacral plexus consists of L4, 5, S1, 2, 3, 4. 3, 4. Okay. So these nerves are forming the sacral plexus, and from the sacral plexus only your very, very important nerve, which we treat very frequently, sciatica, is related to the sacral plexus only. Number 6, coccygeal plexus. S4, 5, and C1. So these are the nerves which are coming out from the coccygeal plexus. So this is about plexus. So if you just remember and understand that plexus is nothing but the congregation of different nerves, blood vessels, lymphatic channels, all these are forming a bunch. So then we call it plexus. And there are different plexus all over just beside the spine. I'll show you one more chart. This is also very important chart, and you keep it with yourself. Whenever needed in future, you can refer to this chart. This is also very important, and one more. Sorry, not this one. This chart is a very useful chart. So if you want to treat a patient through sympathetic and parasympathetic, for example, I'll tell you a very practical use of this chart. If someone is having some response to emergency condition, and that also in a severe form. This happened with one of my close relative also. Someone very close in the relation, the person died, and another person who visited the family of that person was so much in shock that she stopped having food for many a days, and she was continuously crying. So what was that? What type of response was that? Sympathetic or parasympathetic? What type of response was that from the body? Put it in the chat box. Yes, it was sympathetic, not parasympathetic, because sympathetic is activating whenever you are in emergency. So that is super activation of your sympathetic nervous system. That is why the hunger is going down, the person is continuously crying, urination was frequent. So all these symptoms was because of sympathetic nervous system. So which point to get, which point you need to activate more, which point you will tone to increase the energy of that point so that the other system calms down. Balance the sympathetic nervous system. That means sympathetic nervous system point gallbladder 20. Put one methi seed on gallbladder 20 so that it balances, and also balance the autonomic nervous system point ND1A. Simple 2 points, and also I applied a point for parasympathetic nervous system. Okay, it was ST10A. It is a point for vagus nerve because she was not feeling hungry. She was not eating food. And after applying the point, the next day only she said, I today, after so many days, I had 2 chapatis. So this is how you will use this nervous system part of your chapter BHB in your practical application of your points. Okay. So this is about nervous system part of your chapter. After this, give one more example. You can choose n number of examples from your day-to-day life, because whenever you get someone, if you know the nerve, vagus nerve is supplying the heart is beating more, or heart tachycardia, bradycardia, on all these conditions also you can use autonomic nervous system. Salivation is going down because of emergency or excess salivation. Choose autonomic nervous system. Whichever organ we went through right now, whichever areas the nervous system is supplying, see whether it is sympathetic. First, what you need to do, first choose whether it is sympathetic or parasympathetic. Simple. Now you know what is sympathetic and parasympathetic. If it is a sympathetic condition, balance the point. Okay. If it is a parasympathetic condition, give the point of parasympathetic. Okay, so you choose autonomic nervous system along with all the points which you are using. Sir always says, treat a patient in a tripodic way. Treat not only the choose not only the local point, give the point for circulation, give the points for nerve impulse, give the points for muscles also. So this is the reason you're choosing autonomic nervous system or the nerve supply to the area wherever you are choosing. Are you getting me? So this is how we choose autonomic nervous system in protocols. Okay. Now next we come to very important part of the chapter, and that is, it is a locomotor system, isn't it? In your chapter, it is locomotor system. So we said that under locomotor system, one part is nervous system, second part is your bones, and third part is your muscle. So now we'll come to the bony part, bones. Bones. Bone is a very simple topic in comparison to nervous system, but bone is very interesting also. Okay, so understand some basic concepts of bone, and that you will use again in treating patients. So what to understand under bones? What is bone? Bone, all of you know that bone is a part of the skeletal system, isn't it? But what I'm going to tell you right now is very important, and note it down somewhere. How many bones are there in the body? And if I ask you to tell me what are these 206 bones, will you be able to tell me what are these 206 bones? Where are these bones? So note down this. First, understand that bones are actually a part of your skeletal system, and skeletal system can be of two types. One is exo, one is endo. Okay, I got 206. Thank you. So bones are a part of your skeletal system, where the skeletal system can be exoskeletal system or endoskeletal system. Exo means outer. Endo means inside. So what are the exoskeletal parts? Exo parts outside the body. You can see it from outside. Bones are not visible from outside, but there are some part of your skeletal system which are visible from outside. For example, your nails, teeth. No, limbs are part of the body. Limbs are not part of skeletal system. The bony structures which are visible from outside, the teeth, your teeth and nails are visible from outside. So these are exoskeletal system. And endoskeletal system is the bones. And these bones can be of the axial system or of the appendicular system. Now you may say, what is this? Appendicular skeletal system. Axial skeletal system. Bones are inside the body, not visible from outside. So we are calling it endo. And these bones are, if they are present in the axis, central axis, then we call it axial skeletal system. And appendicular means the limbs, 2 hands and 2 legs. So bones of cranium, that means the skull, and spine and chest area, rib area. All these are what? Your axial skeletal system. And bones of the limbs and legs are appendicular, appendages, extensions of the body. Okay, this is a new thing which we should remember. Another important thing we should remember is what are these bones? 206 bones which we are talking about. Write it down and count how many bones we are writing. Okay, and the bones, you will remember the names also gradually. Skull. In the skull, there are actually 21 bones. I'm not giving you the names and the division, but just remember in the skull, in the head, there are 21 bones. Ear, 6 bones. Lower jaw, 1. Neck. In the neck, there is a bone here, hyoid bone, 1. Vertebral column, 26. Now you may say, why 26? What you know is 7, 12, 5, 5, 4. So 5 of sacrum and coccyx, 1 bone are considered as 1, 1 only. So if you count total, it is coming to 26. Sternum, 1. And ribs, 12 pair, that means 24. Okay, sternum means a chest bone, central bone. So these are total coming to 21 plus 6 plus 1, 1, 26, 1 and 24 are coming to 80. 80 bones. Now come to the back side. So this was of the face and front part. Now back side, back chest, scapula, 2, clavicle, 2. Clavicle is actually joining with the back side. No? So we are counting in the back side of the bone. Humerus, 2. Radius, 2. Ulna, 2. Why are we saying humerus 2, radius 2, ulna 2? Because 2 hands. So bilateral, left and right. Carpal. The carpal means the bones of the wrist. So total 8 pair, that means 16 bones. Metacarpal, metacarpal, 5 pair, that means 10 bones. Phalanges, 14 pair, that means 28. So this was of arm. Now of the leg, femur, 2. Patella. Patella is the bone of knee. Okay. So knee bone or patella. 2. Tibia. 2. Fibula. 2. Ankle. Ankle bones are also called. What are the, any idea what is the name of the ankle bone? Like wrist bones are called carpal, ankle bones are called very good, tarsal. So ankle bones, or you can write it as tarsals also. So tarsals are total 14, that means 7 pair. Metatarsal, 10, and toes or phalanges has total 14 pair, that means 28 bones. Okay, and if you total it together, then it is coming to 126. So previous 126 plus 80. 126 plus 80. 206. Okay. So these bones, if we have time in future, I'll definitely show you the different bones also, along with the description and the counting, so that we remember where are these 206 bones in the body. Now, another important thing we need to understand is the composition of bone, how these bones are composed. So always remember, when we talk about composition, very commonly, we always see that one is solid part and one is the liquid part. Here the liquid part is water. Solid part and liquid part, that is water. Under solid part, here, this also very commonly you will see one is always organic and inorganic, other is inorganic. Organic means where the carbon is present. When the carbon is present, we call it organic. And if carbon is absent, different salts are there, then we call it inorganic. Okay. So for example, inorganic example is like calcium, phosphorus. These are inorganic salts. And organic means the collagen. One example I'm just giving you, collagen. Because 95% collagen is present as organic part of the bone. So no need to go into the detail of it. Just remember, bone is made up of two parts. One is solid, one is water. Solid is organic, inorganic. Organic means which has carbon. Inorganic, for example, calcium, phosphorus, etc. So this is the bone. Next important thing which we have to understand and remember is structure of bone. Structure is also very, very simple. What is this bone from inside? Let me see if I have the picture. I'll show you the picture of the bone. Just a moment. Give me a moment. My diagram is in another device. I'll just share and show you. Keep this picture with yourself. Huh? This is a complete picture which gives all the detail which you need to know about the bone. Okay, what you need to see. One is this upper part is called the epiphysis. Just listen to what I'm saying. Huh? Keep this picture and listen to what I'm saying. No need to write it down. This uppermost part is called the epiphysis. This is also epiphysis. This part is called metaphysis. This is also metaphysis. And the third part, the middle part, this part is called the diaphysis. Epiphysis, metaphysis, and diaphysis. This is one thing. Okay. Now see the second part. Next thing, what we need to see is the outermost covering of bone is called periosteum. The covering, hard covering from outside is called periosteum. Okay. Next thing, if you cut a section, vertical section of the bone, the inside of the bone is hollow. Inside of the bone is hollow, and that hollow part has a covering which is called endosteum. Outer covering is periosteum, inside covering is endosteum. And inside endosteum, the cavity is called the medullary cavity. Okay. Medullary cavity contains yellow bone marrow. Medullary cavity, this cavity contains bone marrow. Which type of bone marrow is this? It is called the yellow bone marrow. It's not red bone marrow. It is called yellow bone marrow. Okay. And outside this yellow bone marrow, you can see the hard part. This hard part is actually the compact bone. Okay, the covering is compact bone. And at the ends, you can see the spongy part. So bone has two parts. One is the spongy part and one is the hard part. Okay, this hard part has the red bone marrow. Okay, this is all. This is what you need to know. I'll repeat it again. What did I say? Outermost covering of bone is called periosteum. And this bone is hollow from inside. So hollow covering, hollow part has a covering which is called the endosteum. Okay. The cavity which is lined by endosteum is called the medullary cavity. Inside the medullary cavity, there is yellow bone marrow. Around the yellow bone marrow, there is a compact bone. On the two ends of the bone, there is spongy bone. This spongy bone contains the yellow bone, red bone marrow. Okay. So if you know this part, then you know the structure of bone. This is a basic idea of bone. Now, what is the function of the bone? This was the structure of the bone. See, there's a very, very important part under function. That is what I wanted to tell you all. All of you know that bones has some function, very important functions. For example, bone is solid, it supports the body, it gives mechanical support, it helps in standing the body, it helps in movement of the body, it gives protection to the body. All this is okay. One important, very important point and very important function of bone, which I wanted to tell you all is maximum weight bearing capacity. How much weight a bone can take? Just remember this terminology under the functions of bone. Rest of the functions you know. Maximum weight bearing capacity of any bone, maximum, after which, like if you have a packet, okay, in the packet, if it is 1 kg packet, and if you put 2 kg things, what will happen? It will tear off from a point, isn't it? Similarly, bones have a weight bearing capacity, and if you exceed that weight bearing capacity, that is called breaking point. Just remember this. What is breaking point? Breaking point is the point if one exceeds the maximum weight bearing capacity of the bone. Now we start with the third and the last part of the chapter, and that is muscle. Muscles. Muscle is also a very interesting topic, very simple, very interesting topic. And if you remember only a very small part of it, then you almost know the whole of the muscle. Hmm. So under muscle, what we need to know, there's a very interesting story behind the name actually muscle. Why muscle is called muscle? Muscles are, the term muscle is actually from the word mus, M-U-S, mus. Mus means mouse. In some language, in old Hindi language, it is mouse is also called musa. So mus or musa or mouse is nothing but because of the movement of the animal. So like the mouse, if it is under a rug, a cloth, and it is moving, the type of movement it shows, similar movement is seen in this part, the muscular part of the body, and that is why the name muscle. So this is a small story behind the name muscle. Now, what is this muscle? Muscle is actually a part of the muscular system, which is of two types. One is involuntary muscles. Involuntary muscles are also called non-striated muscles or smooth muscles. One is involuntary muscle in the body, and second one is voluntary muscle. VOLUNTARY. Voluntary muscles or striated muscles or skeletal muscles. So one is involuntary and second is voluntary. Involuntary means which is not controlled by your wish. Voluntary means which is controlled by your wish. So which muscles are controlled by your wish? If I ask you to raise your right hand, raise your right hand. So it is under your wish, isn't it? Not only the bones, but also the muscles. If I ask you to fold your arm, can you fold your arm like this? Yes, you can. Why? Because his muscles are contracting and these muscles are relaxing as per your wish. So these muscles are nothing but the voluntary. Just touch it. You do one thing. You just hold your arm from here and you fold it. Can you feel the stretch? Can you feel it? And then just bring it back to normal. Straighten it. And again fold it. You'll feel that muscles are moving. These muscles are under your control. That is why we call it voluntary muscles or skeletal muscles, because these muscles are attached to the skeletal system, to the bones. Okay. So these muscles, which are called the skeletal muscles, just write down a few lines about it and you'll understand the whole of the structure of the muscle. Each muscle is made up of large number of muscle cells. Muscle is made up of muscle cells. What are these muscle cells? Muscle cells are also called muscle fibers. Okay, this is one point which we need to remember. One point. Second point, each muscle fiber is covered with endomysium. It has a covering. Many muscle fiber are joined together as fascicle. Fasci, fascicle. FASC, fascicle, CLE, fascicle. Many muscle fibers are joined together as fascicle and are covered by mycium. It is covered by perimycium. Many fascicles are encircled by a sheath called epimycium. Epimycium. Now, this may sound little confusing. What is this epimycium, perimycium, endomycium? That is why I asked you to write down this part and compare it with the picture which I'll show you right now, because then you will be able to understand and remember what I'm saying. So this is actually, we are interested only in skeletal muscle. So this is a structure of skeletal muscle. What is the structure? Muscle is made up of muscle cell. This you will remember. Like nervous system is made up of nerve cell. Similarly, muscular system is made up of muscle cell. What is this muscle cell? Muscle cells are also called muscle fiber. Okay, so there are many muscle fibers. So one muscle fiber, two muscle fiber, three muscles. So these are forming, total muscle fibers have a covering, and that is called endomycium. Okay, and many muscle fibers. This is one muscle fiber, a bunch of muscle fiber, another bunch of muscle fiber. All these are covered by perimycium, and many fascicles are covered by epimycium. So small stick, many small sticks, then it's making a bundle. Many bundles, again by a covering. Many bigger bundles, again by a covering. So that is forming muscle. Okay, so muscle is not one single thing. Actually, it is a combination of many units. I'll show you one picture. It is also a complete picture. This is, you just keep this picture with yourself. Afterwards, you compare it with what I have said. Okay, so here you can see the epimycium, perimycium, and also the endomycium. Here you can see the smallest unit, that is myofibril. Many myofibrils are together forming the muscle cell, muscle fiber or muscle cell. Many muscle cells are together forming the fascicle. Okay, I'll show you one thing. First, mark it as epimycium, perimycium, and endomycium. These are the coverings. Now see the unit. What are the different units? Myofibril, number one. Many myofibrils are joining together to form muscle cell. Number two, many muscle cells or muscle fibers are joining together to form the fascicle. And many fascicles are, see, many fascicles. This is one, this is two, this is three. Many fascicles are joined together to form the muscle. Okay, so this is the basic structure of muscle. Now, I'll show you one picture, which is a very nice picture. And this is also, if I ever have the time to explain you this diagram in detail, then I'll tell you this is also a picture which explains how acupressure works. Why one person feels the pain and that pain travels to the brain and how it regulates the muscles and everything. So this is actually one motor unit. What is one motor unit? In your book, it is explained as, I'll tell you the term also, which is explained in the book as neuromuscular junction. Neuromuscular junction. So the nerve endings, you can see the motor neuron here, the nerve endings which are branching and coming to the myofibrils, reaching the myofibrils, muscle cells, each muscle cell. Okay, so whenever there's an impulse, it is actually not on the whole of the muscle, but it is reaching to each and every cell of the muscle. So that impulse is actually contracting and relaxing the whole of the muscle. And if I show you one myofibril, the smallest part, the smallest unit, okay, some of the pictures are actually missing from my device, so I'll share in the group. It's actually a very beautiful picture of The muscle fiber looks like this. Myofibril, not muscle fiber, myofibril. And it has some lines on it. So these lines are nothing but the activated lines, which are called Z line. And in between the two Z lines, it is called sarcomere. So much of detail is not needed. Just understand that this is the unit of muscle, and this unit also has a small unit, which is called sarcomere. And these lines are the lines which are actually contracting and relaxing when the muscle is contracting and relaxing. Okay, so this is one important thing. Along with that, some properties of muscles are there. For example, do I have the permission to take 5 to 10 more minutes of yours? Okay, so those who have time constraint may see the last part of the video in the YouTube. Otherwise, I'll just finish off with few more lines. So there is a very important property. There are rather very few important properties of the muscles, and one of that is excitability. EXCI, excitability. TABILITY, excitability. That means the muscles get excited. If there is some external or internal impulse to the muscle, it gets excited. That is called excitability. Number 2, contractibility. Contractibility. That means it contracts. If there's an impulse given to the, for example, if you press an area with a probe, what happens? The muscles contract. So that is contractibility. And number 3 is conductivity. Conductivity. VITY, conductivity. That means it can conduct impulse through it. That is a property of muscle, and it is very important property. So these are the 3 most important properties of muscles. Along with this, we should know that there are these muscle fibers which we spoke about. Muscle fiber is the unit of muscle. So this muscle fiber is of 2 types. 2 types of muscle fibers, FIBERS, fibers. The 2 type of muscle fibers are, one is called type 1 and second type is called type 2. Type 2 muscle fiber. Type 1 muscle fiber is actually also called red muscle fiber. And type 2 muscle fibers are called white muscle fibers. White muscle fibers. Now this red muscle fiber or type 1 muscle fiber are actually the fibers which are adopted for long and slow postures. And white muscle fibers are the fibers which are actually adopted for fine skills, movements, MENTS. Okay. And because of this slow posture, it fatigues slowly. That means gets tired slowly. And this one, because it is adapted for fine skill, it fatigues rapidly. Example, red muscle fiber. For example, it is seen in marathoners. And this type is seen in sprinters. Because active movement is needed in sprinters. So it is white muscle fiber is more active in them. And in case of marathoners, because they have to save the energy, save the muscle for long run, then which muscle is more active? It is the red muscle which is more active. So these are the 2 type of muscle fibers present in the body. That's all. I hope I have covered the whole of most of the part what is given in the locomotor system, because anatomy and physiology is a part which you can never say it's complete. There's always something to learn. So this is all for today. Next day we'll start with a new chapter, more interesting chapter, more beautiful chapter, and we'll grow more. Thank you so much, everyone. Good night.